Chapter 11, the endocrine system. So the endocrine system pretty much forms a lot of the same functions as the nervous system. That's basically communication and control. The difference with the endocrine system is that it is slower and it's much more long-lasting, and that's because it uses hormones that are secreted into the blood and not those really fast electrical jolts that you get with the nervous system. And the cells that are acted upon by these hormones are called target organ cells. So your endocrine system releases these hormones that reach their target to create an action. So these are the organs in the endocrine system. The other interesting thing about the endocrine system is that everything isn't directly connected. For all the other systems, there's something that links them all together, and for the endocrine system, there's not. There are just these various organs throughout the body that release hormones that do their function wherever they go. So the regulation of hormone secretion. Hormones secretion is controlled by a homeostatic feedback loop. So if you remember, homeostasis is basically the attempt to maintain that internal environment. And so the hormones are secreted or decreased in secretion based on that homeostasis and whatever the body needs. So most of these loops are negative feedback loops, so remember that that's counteracting whatever the action is. So it's the mechanism that tries to send it in the inverse reaction of whatever the change is. Or there's a positive feedback loop. And that's pretty uncommon if you remember, but that's a mechanism that actually amplifies whatever that physical change happens to be. So one example of your endocrine system is your pancreas and the insulin release. So if I eat a meal that's high in glucose, high in carbohydrates, goes through my GI system, and now there's glucose in my blood. Well, glucose can't be broken down by itself. It needs insulin. So that high amount of glucose actually stimulates my pancreas to secrete insulin, which is a hormone that breaks down glucose and makes it so that we can use it. So then it goes to our liver so that it can be digested and used. And then the insulin levels decrease because now we don't need it anymore because now the glucose level has gone down until we eat a high carbohydrate meal again, and then the cycle starts all over again. So some mechanisms of endocrine disease. How does endocrine disease happen? Well, it can either be the hypersecretion, which means that your body secretes too much of whatever that hormone is, or a hyposecretion, which means that there's insufficient amounts being secreted. Because remember, anytime hyper means high, a lot, too much. Hypo means not enough, too little, or low. There's also polyendocrine disease, which can be a hyper or hyposecretion of more than one hormone. So I can have a hypersecretion of just one hormone, or I can have a hyperpolyendocrine disorder, which means that I'm making too much of more than one hormone. There can also be a target cell insensitivity, which basically produces a similar reaction of hyposecretion, except your body's actually secreting the hormone. It's just that the target cell that it's supposed to be acting upon really isn't all that receptive to it. So even though the hormone's there, it's not binding to the target cell, so the action still isn't happening. And then there are endocrinologists that are people that study these endocrine disorders and have actually developed various strategies and treatments like surgery or hormone therapy to try to deal with any of these problems in the human body. So prostaglandins, these are tissue hormones. So they're very powerful substances and they're found very widely throughout the body tissue. They're produced in a tissue and diffuse only a very short distance. So they act only in that tissue around them. So that's why they're tissue hormones. They don't spread throughout the body. They're only in that one specific area. They influence a lot of body functions, and those include things like respirations and blood pressure, gastrointestinal secretions, and reproduction stuff. And that's because, like we said, that prostaglandins are tissue hormones. So something triggers them in that particular tissue, and then they diffuse the short distance to affect the tissue that's actually secreted them. So you have some different glands that secrete hormones. If we remember back to that picture before, there are a bunch of different glands kind of spread throughout your body. One of them is your pituitary gland. And your pituitary gland is divided into an anterior and a posterior. And this is just a list of some of the major hormones that are secreted by your pituitary gland. Probably the biggest one is just your thyroid stimulating hormone. Thyroid is a big thing. Other than that, all of these do serve an important function in your body, but I don't expect you to remember all of them. So what are some major functions of these hormones? Like I said, I kind of want you to know the gist of it, but I don't expect you to know all the details. This is just so that you have the information, you've heard it before, and so that if you ever hear it again in the future, you'll be like, oh yeah, I heard that once in class way back when, so that it's not totally new to you. So you can have the thyroid stimulating hormone, and this stimulates the growth of that thyroid gland, and it stimulates the secretion of your thyroid hormone. There are also some that have to do with your reproductive system, and they release your estrogen and your testosterone. And there's your growth hormone. This stimulates growth. So hypersecretion of this actually results in giantism, where hyposecretion actually can result in dwarfism, because this is going to tell your body how much it should grow. And then there's prolactin. Prolactin actually has to do with breast development during pregnancy, and then the secretion of milk after the baby is born. So, you know, we had an anterior pituitary gland. Well, where there's an anterior, there's a posterior. So we have a posterior pituitary gland. This releases two main hormones. There's the antidiuretic hormone, which is pretty important. So if you think antidiuretic, well, let's think about those two words. Anti means doesn't happen, right? Diuretic is something that makes you pee. So if it's basically not making you pee. So this is the hormone that is hyposecreted if somebody has diabetes insipidus. Diabetes insipidus it's not your typical form of diabetes. It's really a disease that basically makes your body flush out a whole bunch of urine. So if you don't have enough of this antidiuretic, it's going to make you pee too much. And then you have oxytocin. Oxytocin is important with labor and delivery. So like we said with the functions of these hormones, your antidiuretic hormone, so not making you pee pretty much. So this accelerates the water that's being reabsorbed from your kidney tubules in your blood, and it's decreasing the amount of urine that you secrete. And then you have oxytocin, which stimulates that pregnant uterus to contract, and it initiates labor. So oxytocin is actually a hormone that's involved in a positive feedback loop, not in a negative feedback loop. So this is your pituitary gland. It's your anterior and your posterior, and this is just showing you what the hormones are from there and what they're involved in and what they do. So moving on from your pituitary gland, we have your hypothalamus. Your hypothalamus is actually where the production of your antidiuretic hormone and oxytocin occurs. It's just your pituitary gland that has to do with the release of it. So after it's produced in the hypothalamus, these hormones are passed along to your pituitary gland, and that's where the secretion and release of it happens. And that's all controlled by your nervous system. So your hypothalamus controls some other body functions that are related to homeostasis, things like temperature and appetite and thirst. Those are all controlled by your hypothalamus. And then we'll bring you to your thyroid gland. Well, thyroid gland has a couple of hormones in it. The main one that we're really concerned with is your thyroid hormone. And so remember that your anterior pituitary gland had to do with the development of your thyroid gland itself and a little bit in the secretion of it. But this is actually where that thyroid hormone is secreted. And the other hormone there is calcitonin. So the functions of these, your thyroid hormone really has a lot to do with your body's metabolic rate. So it's going to speed up or slow down your body's metabolic rate. And then calcitonin has to do with decreasing your blood calcium concentration. And it does that by inhibiting the breakdown of bone, which would normally release that calcium from your bone into your bloodstream. So if you have hyperthyroidism, so hyper, too much, so that is too much secretion of your thyroid hormone, it actually increases your metabolic rate. So hyperthyroid, kind of hypermetabolic, goes up together. And that's characterized normally by restlessness and weight loss, and those protruding eyes that you see people. They look like they're having bug eyes going on. This is called Graves' disease. if it's in its inherited form of hyperthyroidism. There we go. So Graves' disease, the inherited form of hyperthyroidism. Remember, hyperthyroid, hypermetabolic. Now, if you are hypometabolic, it means that you are not secreting enough of this thyroid hormone. It actually slows down your metabolic system. So this can be caused by a couple of different things. One of them is just a simple goiter. You can have just a simple goiter, which is this painless enlargement of your thyroid gland, and that's caused by having a dietary deficiency of iodine. That's actually why they started making iodized salt, and that was to put iodine in salt that we add to things, just because that you could put iodine on salt without really changing the salt or changing the flavor or anything, and it made people get enough iodine in their diet that goiters almost completely went away. The hyposecretion of thyroid hormone can also be happen during the early development, and this can result in cretinism, and that causes a low metabolic rate and dysmus growth, and can even cause mental retardation. In adults that get this, they can have myxedema, and that's when they get weight gain and hair loss and edema. It's actually more common than people would think, I guess, thyroid disorders, and there are actually a lot of people that take some thyroid, either stimulants or depressants, or if they have hyper, end up having to have their thyroid out and taking some synthetic thyroid hormone just to replace this because of some alterations in their thyroid. So there we go. There's just the picture. This is your thyroid gland right here. So that's your hyoid bone and your epiglottis. This is your trachea coming down. So it's right there where your vocal cords are. So now to move on from your thyroid hormone, let's cover your parathyroid. So parathyroid, the name of the hormone here is just your parathyroid hormone. And the function of this hormone is to increase your blood calcium concentration. So remember, one of the functions of your thyroid gland was to release calcitonin, which decreased your blood calcium, and this one increases your blood calcium by breaking down bones so that it releases the calcium into the blood. So those two would work together to maintain homeostasis, right? You need a certain amount of calcium in your blood, so your thyroid hormone will release calcitonin to decrease it if you got too much, and then if you had too little, your parathyroid would release the parathyroid hormone to increase it. So they're working together to maintain that balance. So then we have the adrenal glands. Your adrenal glands, they release corticoids, which are a type of steroids, and they have to do with your sex hormones too, and they secrete cortisol and aldosterone. There are different layers of them, and they kind of release the different things. I don't expect you to know which one releases where or anything like that. What I want you to know is the mineralocorticoids do have an effect on your blood sodium and potassium level by accelerating how well your kidneys reabsorb or excrete them. And glucocorticoids, so that's like your hydrocortisone, those help to maintain your blood glucose level concentrations. They're very essential also in maintaining a normal blood pressure. If those get off, your adrenal glands aren't secreting the correct amount of those glucocorticoids, your blood pressure might be really off. They also produce a very strong anti-inflammatory effect. So they are they're part of a normal recovery from an inflammatory process because they have an anti-inflammatory, so not inflammatory effect. They also have an anti-immunity and anti-allergy effect. So that means that they're going to kind of chill out your immune system if it's overreacting, or calm down an allergy effect if it's overreacting. So glucocorticoids also increase a lot when you're in situations of very high stress. And that's because you want that high blood pressure. It's kind of triggering that like fight or flight response in your body. So you actually want to, in that sense, cut down on inflammation and cut down on immunity and allergy reactions and up your blood pressure and be ready to run from something, and not, your body doesn't care at that point about healing. What it cares about is that stress and whatever's stressing you and getting away from it. So you have that decreased inflammatory reaction and decreased immunity and increased blood pressure. So here you can see this is just a little outline of what happens if you have a high glucocorticoid in your blood. So what happens is that it can actually have a couple different effects. So it's going to inhibit your inflammatory response, which is going to accelerate how well you recover from the inflammation. So if you're just inflamed to be inflamed, like if it's an autoimmune response, that can actually be a good thing. If you're inflamed for a reason, it might not be a good thing. That high glucocorticoid reaction can actually atrophy your thalamus, which decreases your immunity, and it also decreases your allergic response. And it increases your metabolism of fats and proteins in your tissue, and that's because your body uses those things as like backup energy sources. So right now it's panicked and it's saying, all right, I need to start using these fats and these proteins and be ready to run from whatever I have to do. So it's breaking down that stuff. But what that's causing, it's causing a hyperglycemia, because it's broken down these things into something your body uses for energy. So now your blood sugar is at a very, very high level. So, adrenal glands. Some of the main things that this releases is epinephrine, which is also known as adrenaline, or norepinephrine. The functions of these hormones are that they're going to help the body resist stress by intensifying or prolonging the effects of that sympathetic stimulation. So an increased epinephrine secretion is that first endocrine response to stress. So it's how you're dealing with that stress. So not only are you releasing those glucocorticoids, you're also releasing epinephrine. So if there's a hypersecretion of those glucocorticoids, it actually causes Cushing's syndrome, which causes that kind of round moon face, can actually cause kind of a humped back appearance. Elevated blood sugars, and those elevated blood sugars actually make you predisposed to a lot of infections. Not just the elevated blood sugars, but you have that decrease in immunity, and then you have the elevated blood sugars on top of it. So why are the two linked? Well, bacteria really, really like those high sugar levels because they use sugar for energy as well. So now not only is our immune system not working well, we've created this nice, warm, wet environment with lots of food for them. So now they're really going to be able to take over. And then you can have hypersecretion of the adrenal glands, and that can actually happen by a virilizing tumor, and that causes the masculinization of women. So it's like too much is being released from that adrenal gland, and causes some masculine effects or masculine characteristics to occur in women. Now, a hyposecretion of those cortical hormones actually results in what's called Addison's disease. And that is when there's muscle weakness and reduced blood sugar, normally nausea and loss of appetite and loss of weight. So that's when there's not enough of those hormones that are going to help you release that blood sugar and give you that fight or flight response. So your blood sugar's low and you don't feel good and you're losing weight, that kind of stuff. And that is Addison's disease. So your pancreas. Your pancreas is super important because it's going to secrete two different hormones. Glucagon, which is secreted from the alpha cells, pardon me, and insulin, which is secreted from your beta cells. So what are the functions of these hormones? Glucagon actually increases your blood glucose by accelerating liver gluconeogenesis. So what does that mean? That's actually when your liver converts glycogen. Glycogen is how glucose is stored in your liver, to glucose, which is what your body uses. So glucagon comes into effect when you don't have a lot of glucose already circulating in your system. So let's say that I haven't eaten, like I ate breakfast this morning and then I've been super, super busy all day and I haven't been able to eat anything. Now my body's releasing glucagon so that it will do gluconeogenesis in my liver, break down the glycogen that I have stored, and release it as glucose that I can use for energy. So it's just a picture of your pancreas right there and the common bile duct. So that's what it's using to secrete what it makes into your intestines. So now that we know what glucagon does, what does insulin do? Well, insulin decreases your blood glucose because it accelerates the movement of that glucose out of the blood and into the cells where it can be used by the cells, because glucose is really the best form of energy that our cells have. So that's what the insulin does, is it's how our cells actually are able to use that glucose that we take in for energy. So the disease that's associated with this low insulin levels or with your pancreas is diabetes. Now, diabetes is really a huge, huge epidemic in our country. I really cannot stress that enough. Diabetes is huge, and it's one of the major complications of our common diets and our weight problems and all the changes that we've seen happen to our society over more recent years. But the other thing with diabetes is that diabetes in itself can cause tremendous complications in people, tremendous health complications and comorbidities that happen. So diabetes is really huge and super important to understand. So diabetes comes in two different forms. There's type 1. Type 1 is actually caused by the hyposecretion of insulin. So that means that your pancreas just doesn't make enough insulin. This is the kind that normally people get when they're very young, and they're just not making enough insulin. These are the people that have to be on insulin for the rest of their lives. And then there's type 2. Type 2 is a result of your target cells becoming insensitive to insulin. So now insulin just doesn't work as well for you. And these are the people that, yeah, maybe they need to take some insulin too to really flood their system with it, but at the same time, it just doesn't work as well for them. These are the people that really need to look at altering their diet and their lifestyle. And there are some medications that they can take besides insulin that will help their body become less sensitive or utilize the insulin even better. And that's because glucose cannot enter the cells, so it just stays in the blood cells without insulin. And that's really what diabetes is that it's a problem with your insulin. So either you don't make enough or your target cells are insensitive to it. The end result is pretty much the same, and that's that your cells can't get the glucose, so they can't use it for energy. So basically your cells are starving, even though there's all of this glucose floating around in your blood. Now, there is all of this glucose floating around in your blood, which your body really doesn't like, and that causes you to have glucosuria, and that means you have a lot of glucose in your urine. Because you have so much of it in your blood, your body's trying super hard to excrete it, pee it out, because it knows that there's too much of it. And that high glucose level in your blood is also going to predispose you to a whole lot of other complications. So this is a little table that's just showing you about some of the complications that's going to happen if you don't have enough insulin in your blood. So if you have diabetes, whether it's the hyposecretion or the malfunction of the target cells and how they recept it, you're going to have a decrease in how effective insulin is. So what that happens is that means that it's going to cause an increase in blood glucose. So you have hyperglycemia, hyper, too much, glycemia, blood sugar, so hyperglycemia. What happens is that your kidney now has to try to excrete all of that extra stuff, which means that you now have glucose in your urine. Problem with that is that water also follows. So now you have this increase in urine output, polyuria. You have a net body loss and causes you to be super thirsty. What also happens is that you have an increase in glucose in all of your body fluids. and that provides nutrients from microorganisms, so your body can't use it because your body needs insulin to use it, but all those microorganisms can, so now you're super predisposed to getting an infection. Now, what also happens is that that glucose that's now feeding the microorganisms is not feeding your cells. So your neurons, they're normally the first ones to starve because your neurons are a part of your body that actually really need glucose to exist. They can't get their nutrients from other things. And that's why you hear people talk about a diabetic coma, because they don't have enough glucose to feed their nervous system. So they'd go into a coma because their nervous system can't survive. Also causes various nervous diseases, and that's things like they start losing sensation. They have normally it starts out in their feet and they just don't feel things as well because those starving cells are actually damaged and they can die over time. The other stuff that can happen is that they have to shift from carbohydrates to using fat because they can't use that carbohydrate, which does cause weight loss, which I know to most people probably they think sounds like a great thing, but that breakdown of fat is also going to cause some byproducts called ketones that actually affects your body's pH level that it now can't correct, which can cause you to go into a coma. Or it increases your body lipid level. So you have hyperlipidemia, high lipid level in your blood, which actually damages your vasculature, which then causes cardiovascular disorders or gallstones, neither one of which are very great. Gallstones, super uncomfortable. Cardiovascular disorders actually branch off. So now you're talking about getting heart disease, ulcers, gangrene, losing limbs, kidney disease. You get retinal damage that can lead to blindness. There are so many complications from untreated diabetes. This is one of the things that if you see it on somebody's history, you just know that they're going to have a lot of complications down the road, especially if they haven't been good about watching it and taking care of themselves. So that's why knowing about diabetes is super important because, like I said, besides all these complications, it's basically an epidemic in our country. I know in the hospital where I work, most of our patients have diabetes as a complication. It's very standard that anybody that walks through the door, we're checking blood sugars on and covering them because we just know that their body isn't going to make enough insulin to help them heal or have a meaningful recovery. All right, so off my high horse. In relationship to diabetes, we're just going to very quickly touch on some of your sex glands. So for female sex glands, you have the ovaries. These are structures that secrete hormones. So they're going to they have the effects of estrogen. Estrogen is the feminizing hormone, and that has to do with the development and maturity of the breast and the external genitalia that you see. So the development of the adult female body contours and the initiation of the woman's menstrual cycle. There we go. And then we have the male. So male sex glands. So these are the interstitial cells of the testes secretes testosterone. And what are the effects of testosterone? Well, that's going to cause the male external genitalia. That also is going to cause their facial hair to grow and their voice to change. So that's when they get those nice deep voices. And the development of that kind of typical male body contours and how their musculature becomes shaped. So that's what testosterone does. Okay, so now moving on, I know I'm kind of flying forward here. We have the thalamus. So the hormone that's secreted here is thymosin. And what is the effect of this? Well, it plays a very important role in the development of your body's immune system. So the thalamus is tied to your immune system. Because now if you remember back to those glucocorticoids, if you had too much glucocorticoids, it decreased your thalamus, which decreased your body's immune system, right? So you can kind of see where some of this stuff is all linked together. And then you have your placenta. Your placenta does have to do more with the female body, I admit. And your placenta releases kind of its own set of hormones. It's going to release estrogen and progesterone. as well as a couple of other things. And what is the function of these hormones? Well, they're going to maintain that membrane around the fetus during pregnancy, which is definitely pretty important for bringing new life into the world. So then your penile gland. Your penile gland is a very small gland near the roof of the third ventricle of the brain. Kind of imagine it. It's called your third eye, and it's because if you put your finger sort of up in between your eyes a little bit higher, sort of between your eyebrows, and kind of pushed it back into your head, that would be where it is. So it's made of glandular tissue, and it predominates in children and young adults. It kind of becomes more fibrous and calcifies with age. And it's called your third eye because it influences the secretory activity that's related to how much light enters your eyes. So that's why the younger you are, the better vision you have, right? Because that pineal gland is helping with that. And because it has something to do with your sense of light and how you see and how you interpret light, it's also going to secrete melatonin. Melatonin helps to regulate your body's internal clock. Some people have probably heard of melatonin. They now sell it over the counter as well. And that's what it's used for. It's used to help regulate your body's internal clock and regulate when your body thinks it should start sleeping. So an abnormal secretion of or a sensitivity to melatonin is actually what they think produces seasonal affective disorder, which is like the winter depression, your winter blues. So that's a form of depression that actually occurs in the wintertime, especially in those northern states like Maine, where I live. Where during the wintertime it's very cold, people don't spend a lot of time outside, and it gets dark really early in the afternoon and it stays dark really late in the morning. And because of that lack of light and that lack of exposure to natural sunlight, it actually increases your melatonin production, because melatonin is going to say, oh, there's no light, it's nighttime, you should go to sleep now. So during the wintertime, you actually produce too much of that melatonin, at least in these people that have SAD, or seasonal affective disorder, and that causes them to become depressed. And that's why they actually use a lot of light therapy, or tell people to try to get out in the sun and spend some more time out in the sun, because it can help correct their melatonin levels. And so just for a couple other endocrine structures, there are a lot of organs like your stomach and your intestines and your kidneys that can produce their own endocrine hormones. If you remember, we talked a little bit in the beginning about those tissue hormones that can be released. And your atrial wall of your heart actually does secrete its own hormone too. And that kind of stimulates a little bit of the sodium loss from your kidneys, and that's because it's helping to regulate some of the fluid volume that's in your vasculature. And then you have some fat storing cells that secrete leptin, and that has to do with controlling how full or how hungry you feel. So if those cells feel like they don't have enough fat stored, they're going to make you feel hungry, so you eat more. If they feel like they do, they make you feel more full, so that you stop eating. And that brings us to the end of our endocrine slides.